Welcome to another installment of Extending Health Span. Today is just a quick review of the brain hormones, and then I'm going to go on to learning and messaging. So remember, we're going to go through the satiety hormones, the hunger hormone, single hormone we're going to talk about, and then talk about how the brain learns, retains information, and how that information is delivered. So the norm is that you're on this steady roller coaster ride where you're hungry, then satisfied, then hungry and satisfied. And it's this interplay of these hormones from the stomach, and then several hormones giving feedback from the adipose tissue, GI tract, and pancreas. And that's happening every 3 hours, roughly. And that's all based on food transit time. So basically, you've got food in the mouth for a minute, down the esophagus. In the stomach, it can go from anywhere to 2 to 4 hours. And then it goes into the stomach, from the stomach into the small intestines, and then down into the colon. But what this transit time means, well, actually, I'm going to tell you after you answer this question. What would make gastric emptying time faster? Solid meal, a liquid meal, or both the same? So liquid meals make it go much faster. So if you look at this graph, it shows that a solid meal takes a lot more time to digest, to churn, whereas a liquid meal gets absorbed pretty quickly and gets passed on. So the clinical relevance for this is that these liquid replacement shakes, you're going to have a tendency to be hungry sooner because of this faster gastric emptying time. So back, just an overview of the satiety feedback mechanisms. When the stomach gets full, the ghrelin levels slowly stop over about 30 minutes or so, and then you slowly start to get this satiety feedback. And that's through these gut hormones, the GI tract, leptin from the adipose tissue, insulin from the pancreas, and then slowly this sensation of hunger starts to diminish. So if adipose tissue is releasing leptin, why don't people with excess adipose stores have a decreased appetite? Really good question. Is it because they have no self-control, or do they have a resistance to leptin feedback? And I'm hoping you're going to pick they have a resistance to leptin feedback. Elevated levels of adipose tissue actually create inflammation of the hypothalamus. So although the signals are there, the report is not getting through. So this leptin receptor resistance. Okay, so I'm going to go on to another topic that is going to pertain to everything about eating and behavior, and also how to remember and convey information. So we're going to go back to the mammalian brain, how it's designed specifically for memory and learning. Notice how all of these are related to the mammalian brain, the middle of your brain, eating, learning, everything. So using those special senses is the most efficient way to learn. And the special senses, of course, the vision, hearing, smell, taste, touch, all transmit information into the thalamus, and that conveys information either to the hypothalamus or other parts of the brain. And then just below it is that hippocampus, that little blue structure. That's the memory center. The sense that's has a direct connection, like a real direct connection, is this olfactory. So memories are very much solidified with smells. When I looked up the different smells that help retain memories best, suggestions were cinnamon, mints, but all senses, all smells um, helps to solidify memory. And this is cranial nerve 1. And the reason I have it on a nose is because you have one nose, and that helps me to remember cranial nerve 1, the number, which cranial nerve it is. So they did a research study, and they had participants in 2 groups. Actually, this was a researcher that was also a professor. So he was teaching 2 groups of students, and with one of his students, with exactly the same lecture, he put a smell on the wall. And then the other group did not have a smell in the room. And I think he ended up using something subtle. I think he used a brute cologne or something fairly subtle where the students didn't notice. And then they tested the students with exactly the same exam to see how their performance was. And the results of the students that had learning in the presence of a smell had a significantly improved memory, did better on their exam than the students that did not have a smell. So let's go into vision. Cranial nerve 2. You remember that because you have 2 eyes. It is incredibly superior for efficiency of learning. So here's a scenario. You've studied for a history midterm. You only read words, the textbook. You get a great score, 95% on the exam. So the final exam is cumulative. So you're going to have to remember everything you read for your final exam. So how much of the information you learned for the midterm will be retained for the final exam? 10%, 60%, or 100%? The answer is, if you don't study anymore, you're only going to remember 10%. And this comes down to reading versus using visuals for memory retention. This is another study where they took 2 groups of students. The first group studied only words, and the second group studied both words and images. And then they were tested 3 days later. They found that the students that were able to study pictures along with words had a significantly greater retention. So 60% 3 days later of their retention. And the effect is called the picture superiority effect, how you learn much better and things retain much longer if you do it in the presence of images. To make the information stick, we're going to use special senses to learn and to convey information. And we're going to go through all of these others, special senses, of course, how stress affects exercise, sleep, visuals, smells, all help that information stick. I want to make one comment about what you do during class, how to take notes. The problem with taking notes during class is the physical act is competing with the special senses for attention. So how on earth are you going to stop taking notes? And if you're not taking notes, how are you going to stay alert? I did a study with that too. So they found that if students took notes, they did much better if they did it with a pen and a paper, longhand. People that actually type become like stenographers. So they're just transcriptionists, transcribing the information to look at it later. Very inefficient for learning. So if you're going to take notes, use a pen and paper. Just jot a little note to remember something in the lecture, but specifically in this series of lectures, everything is on the PowerPoints that's necessary. And so there's really no reason to be transcribing what is being said. Now, to encourage participation, to keep people from falling asleep, there's this audience participation. So while the class is being given, we're going to be using Kahoot. And then for the presentation, I'm going to be having intermittent questions as you've been following along. So this will be a poll question. This will be a poll question for in-person classes, how you prepare for your exam in a typical class. So my recommendations, and I can only recommend for my particular classes, is that we have weekly quizzes that solidifies the information. The in-class Kahoot questions, of course, are not going to be contributing much at all to final grade. And then the weekly quizzes a little more. Flashcards are great to test yourself. So basically, the more you test yourself, the more that information becomes solidified. So let's go back to the power of images. Advertisers have known the power of images for a long time. The top images of the campaign for the public health campaigns, finally, they're starting to use the same advertising techniques as the manufacturers. So the top is showing every breath you take will eventually destroy your future. Then the bottom, the product manufacturers, showing Marlboro lights, and then they're forced to have this warning that's in tiny, tiny print that very few people bother reading. So notice they use images to convey their information, and they use words because they're forced by law to have a warning. So they know how to manipulate an audience. These were the early commercials for Virginia Slims to get this visual appeal, and they were speaking to the audience. They were trying to get more people of the female population to start buying cigarettes. And this was initially created during the women's liberation, the 1960s and 70s. And so they were speaking to the concerns, and they were trying to ignite emotions. So this is Philip Morris's campaign. They were trying to entrain women into buying cigarettes. Notice how they used images, black and white, suggesting you're in the past if you're hiding out with your cigarette. Come a long way, baby. So advertisers target the mammalian brain for advertising, the emotional brain. So for the situation where people are trying to lose weight, notice how they use the advertising using a beautiful woman, top shape, appealing to emotions. Now this goes into medical advertising. And we're going to go, this kind of will take us in a little bit into research, how to look at research a little bit more critically. So in 1957, they had a medical advertising campaign for thalidomide. This was in France, I believe, when it started. It's suggesting that if you take this medication, you'll prevent morning sickness and you'll prevent miscarriage. And when the term they use, abortion, means is a medical term for premature loss of the baby, not for medically induced abortion. So they're saying here in this advertisement, it's recommended for routine prevention of miscarriage for all pregnancy. Unfortunately, by 1961, they started seeing these children being born with significant limb defects. The women, the daughters of the mothers who took thalidomide during pregnancy had vaginal abnormalities and cancers, vaginal cancers by the age of 20. Now, this was a problem because thalidomide came out without any randomized controlled trials, RCTs. We're going to see a lot of that acronym RCTs for randomized controlled trials. So the randomized controlled trials are like the be all end all. It's not always possible in certain types of studies. However, in a randomized controlled trial, they take a treatment group, a control group, and they randomly assign who goes in which group. And then they follow up and compare the results. This is hopefully intended to reduce all the variables that can impact the results. So prior to these randomized controlled trials, there was no standardized way to interpret data. And then anecdotal evidence was taken as fact. And again, they were using emotion to make clinical decisions. So here was a study question. Does hydroxychloroquine work to treat COVID? And this really hit emotions because, of course, with the COVID. So this French physician was hoping that that hydroxychloroquine would work. So his study design was with 26 patients. Only 20 appeared in the final results. 6 of them dropped out due to side effects or they died. So when the French government biostatistician looked at it, they realized that their results could not be attributable to treatment with hydroxychloroquine. The problem is the cat was out of the bag at that point. So what type of study design was used? Randomly controlled trial, case series, or a cohort study? The answer is he just presented several series of patients that were all treated with hydroxychloroquine. This is a pyramid design style for you to look at the more robust studies. Case reports down here is essentially no design, and that's what his presentation was a case series. Then there's observational studies, and then randomly controlled trials. And then up further on the tier is where a meta-analysis, when they're looking at multiple studies of similar designs, and then they filter it out, and then they come up with a final clinical practice guideline. So the researchers in the US did do a multi-center blinded placebo-controlled randomized clinical trial with hydroxychloroquine. And more than 470 were enrolled in the study at the time the study was closed. And so they said that it showed no treatment, no harm, but provided no benefit. So it was essentially the treatment, and the study was halted. So researching is pretty tough. PubMed is probably a great way. But one of the ways you can do is simply look up Google and look up and put in some keywords, and then you come across articles that some health reporters have done some research, and then you look up their references and then put in their references into PubMed. That actually is another option for trying to find articles. So when you're doing a presentation. For this particular class, we're going to be doing a presentation, 4 to 8 slides, using images and words, describe the study question, presenting in 10 to 15 minutes, and allowing 5 minutes for questions. So in summary, talked about hormones, just to review, about how the brain learns and how to convey information and how to look at research. Remember, the hunger and satiety is a steady roller coaster ride. As your stomach empties, the ghrelin starts to increase. And then the food releases that feel-good hormone dopamine, encouraging you to repeat the eating behavior. And then the satiety comes from leptin, the GI hormones, and insulin. So my eating advice, expect that you're going to be hungry about every 3 hours when you're awake. And also, it's important, get to bed 3 hours after the last meal before ghrelin starts rising again. Eat slowly to recognize that slow onset of satiety. And then remember that liquids have a faster gastric emptying time. So that's actually, I'm not suggesting you stay away from liquids. Actually, it's a great way to get nutrition. Making a smoothie, putting frozen fruits and vegetables where you can't even taste the vegetables if they're frozen. A good way to get solid nutrition. And then use special senses to be able to pay attention in any classes, including this one. Using smells, studying in Starbucks. It's one of the great smells. I think they don't allow their employees to wear cologne that competes with the coffee smell. And then for efficient learning, just minimal note taking, only a pen and paper, and then testing yourself over and over again. So with this class, we're using Kahoot questions in class, and then weekly quizzes. And then to present, use pictures or videos, a lot more than words. Know your audience, so speak to your audience using language that they understand. And keep it concise. So basically, more is not better. It's actually more difficult to create a lecture or a presentation that's short, that's only short duration. It's much more difficult than a longer lecture because you have to weed out what's not necessary. So any questions, please leave comments, subscribe to the channel. We'll get into some more interesting topics the next time.